Hey, what's up, guys? It's Dr. Tim Jackson, DPT, with another episode of the Boss Body Podcast. Today, I have with us another very special guest, Dr. Tami Meraglia. Dr. Tami is a medical doctor and a leader in functional and regenerative medicine and specializes in hormones, weight loss, and stem cells. She's the best-selling author of The Hormone Secret, published by Simon & Schuster, has appeared on Good Morning America, Fox, ABC, NBC, and many podcasts and summits as a health expert. She lectures both nationally and internationally at conferences such as the American Academy of Anti-Aging Medicine. She's the CEO and medical director of BioThrive Health that offers personalized medical programs in person in Seattle and virtually across the United States. Welcome, Dr. Tami.
Hey, thank you so much for having me.
Yes, we are so excited to talk with you. You're a wealth of knowledge in so many different areas, but I know one area that you're passionate about is metabolism. And one thing you've been working on for the past year or so is semaglutide. Can you tell us what semaglutide is and how you use it?
Yes, well, lots of people actually are aware of semaglutide. You might have heard it because it has lots of different names: Ozempic, Wegovy, Manjaro. There's lots and lots of different types of these medications. They're an IGL-1 P1 agonist. And they've actually been around for a really long time. And I love that. I don't like being an early adopter. I'm old enough to remember thalidomide and how we all thought, not we, I wasn't a physician or even born yet, but it was approved, right? It was approved for anxiety, sleep, vomiting in pregnancy, and then horrible, horrible results. So I love that this medication has been around for a really long time. It was first FDA approved for diabetics, and it does lower your blood glucose. But it was recently also researched and received FDA approval for weight loss. And it is not FDA approved for quote unquote anti-aging or longevity, but in my opinion, it should be. And I'm not sure whether or not that's mostly through the mechanism of balancing blood glucose. Glucose is such a toxic thing in our bodies, and what we eat is a part of how and why our blood glucose goes up. People forget that stress also increases your blood glucose. And so having that higher blood glucose, even some of the day going up and down, leads to a lot of inflammation. And inflammation is the source of everything that happens to us that's bad, right? Whether it's your
Absolutely.
brain, your bones, your heart, your longevity, depression, neurodegenerative diseases, doesn't matter what you talk about in medicine, inflammation is a bad player and a significant player in what's going on. And I love that some of the potential benefits that we're seeing in semaglutide is a lowering of inflammation.
Absolutely. I remember being an undergrad and, well, first of all, my freshman year, I think basically what we were taught is that fat tissue is mostly structural. But by the time I was a junior in my nutrition and exercise physiology class, we learned that it's a very dynamic tissue. It releases pro-inflammatory cytokines. And so if anything, not only by lowering blood sugar, but by decreasing fat deposition, you're going to decrease inflammation.
Yeah, it even has enzymes that change your hormones.
Mm-hmm.
Fat is, I like to call it an organ.
Mm-hmm.
It's alive and well and busy. And,
Absolutely.
there's different types of fat. There's brown fat and there's white fat. And it turns out that one of the potential benefits of semaglutide actually might be that helpful conversion of those bad fats to a better fat. So there's so many things that are going on with this medication, in addition to weight loss, that I actually haven't seen anything as significant, except for, of course, stem cells. in my medical career. And so I'm super excited that we're able to offer this sort of nationwide. We have a physician that has a telemedicine license in every state. So we're just seeing this amazing transformation of people becoming the CEO of their own health. And what I mean by that is not everybody, but there's a certain subset of people that one of the reasons that they struggle with weight loss is their relationship with food. If we only ate what we needed, none of us would ever be overweight. But our food industry has actually changed our food so that it has changed our microbiome and our brain. It literally makes us addicted to our foods, and it makes us think about food. It makes us want more food. And so it's really hijacked our normal system of saying, oh, that tastes good and I've had enough. I'm full. You're
Absolutely.
full, and then you want dessert. Why
Right.
is that? Why do you want dessert? It's these chemicals, and sugar is a big part of that. And time again, what my patients on semaglutide tell us is that their relationship with food has changed. They're in charge. They can say yes, or they can say no. They can say yes to 2 bites, or they can say, no, I don't need or want it at all. So I've always wanted people to be the CEO of their own health. People like you and I, just librarians. We're
Right.
just here to guide people, give people a bunch of information that we research a little bit deeper, hopefully a little bit better, having learned, many, many years of medicine, and present it so that people can decide for themselves. And so I love that people are becoming able to make better choices more easily.
Yeah, I think becoming the CEO of your own health, like you stated that perfectly, because if you're just relying on traditional allopathic medicine, outside of acute care, we don't rank very high when compared to other countries.
No,
And
it's not
yeah,
healthcare, it's sick care. And I'm glad
absolutely.
we have it, right?
Right.
If you have a burst appendix, I'm super happy that there's a surgeon, there's an anesthesiologist, there's antibiotics, I'm happy that we have this. But let's not confuse our traditional Western sick care with actual health care or wellness. The absence of disease does not equal wellness. It just means you're not sick yet.
Right. Exactly. And I wish so many people would understand that, because they say, oh, I'm fine. When I ask them, how do you know? Have you had testing done lately? Oh, no, it's been 5 or 6 years since I've had any blood work. So you think just because you don't have any symptoms that you're optimized? And
Yeah.
I don't want to scare people, but I tell them to take a look underneath the hood, just like you do
Right.
with your car,
Oh,
you
yeah.
know?
You don't wait until it's clanking and smoking and lurching
Right. It's kind of like waiting for all those things to happen, get a flat tire, the engine to go up in smoke before you take action and do anything. But with semaglutide, one thing I want to ask you, so let's say someone is 350 pounds. Are they going to need to be on it longer than someone who's 240 pounds?
Well, yes, potentially. I actually have a patient who's well over 300 pounds, ex NFL and retired. And his goal is to be like 300 pounds. So he might not need to be on it for a really long time because he's just so big, and his goal isn't to get down to, 200, 250. But you aren't going to lose, 20 pounds a week. And that's a good thing.
Right.
For a number of reasons. One is when you lose weight more slowly, you don't have hair loss. Hair loss is something that happens from rapid weight loss. Also, your skin elasticity can actually accommodate and catch up. If you go from here to here really quickly, you'll end up with a lot of loose skin that didn't have time to catch
Right.
up. But generally speaking, the more weight that you have to lose, the longer that you're going to be on it. We have a 4-month starter program. And the reason it's 4 months is that a lot of the side effects, and we can talk about those in a moment, but a lot of the negative side effects can be mitigated if you start off at a very low dose. And I find the majority of my patients are actually having successful weight loss at a lower dose than the, for example, pre-filled Ozempic 2.4 milligram pens. So, even with bioidentical hormones or medication, or whether it's semaglutide, I want to use the lowest effective dose possible and customize it to what's working with you. And so I think that if you're changing nothing in your life, other than taking this medication, you might need a higher dose. I do hate semaglutide because it does work. And you don't have to change your lifestyle. You don't have to change your diet. But when you do, and we guide our patients through a customized way, not everybody benefits from a keto diet. Not everybody wants to eat animal protein. So we meet you where you are and make the inflammation and health the goal rather than calories or macronutrient counting and things like that. With the one exception, protein. People who take semaglutide are going to eat less. One of the main side effects is, and it's on purpose, is that you have less appetite. It works both in your brain to make you think that you're full, but it also delays your gastric emptying. So you actually feel full for longer. And when this happens, if you're eating less, but you're eating the same ratio of protein to carbohydrates and other things, then you're actually eating a lot less protein. And what I tell patients is we want to make sure that you're prioritizing protein and moving your body. We need to stress your muscles in a good way. That's called hormesis, right? That's what weightlifting is. We want to stress our muscles. Why? Because you want to end up with a body you love at the end of your weight loss journey.
And muscle is metabolic currency, right?
It is. And then you have an easier time of maintaining your weight loss because your body is burning more calories at rest. Also, from a longevity perspective, I don't actually focus on lifespan. I want to focus on health span because I do not want to be here at 100 unless I'm full of vitality in my body and brain. And so the health span actually is directly correlated with muscle mass. The whole thing of frailty that happens to us as we age is we lose strength and muscle mass, no matter what you do. So we have to fight this with an uphill battle. And when you're losing weight, it's even more important. So there's lots of tricks that we tell people on how to, increase the protein, but prioritizing protein so that when you're finished your weight loss journey, you love the body that you're left with, and you don't look like you lost weight because you were sick. Right. Everybody knows what that looks like. And you go, oh my gosh, are you okay? You've lost a lot of weight. And somebody will be like, yeah, I had the stomach flu for like 10 days and I couldn't keep anything down. That's not the same as somebody who's been going to the gym and eating enough protein and lost the same amount of weight, but they look completely different.
Yeah, I had to get out of the orthopedic world because, in general, the recommendations for quote unquote older adults, use light weights, high reps, focus on balance exercises. But what they don't tell you is in order to have proprioception or balance, you got to have full range of motion and you got to have strong muscles. The number one cause of, dying or falls is a weak hip cuff. So most people know about the rotator cuff, but you have a cup around your hip, the gluteus medius, gluteus maximus that pull the head of the femur. And so if you build muscle mass and start depositing that metabolic currency, it's like building up an investment account. And so when you get time, or when you get to 70 or 75, 80, you're gonna just work on maintaining, assuming that your protein intake is good and your testosterone and sex hormones are good.
Well, people don't realize that your ability to absorb the protein that you eat decreases as we age. So we actually have to eat more protein because we get less and less efficient. That shouldn't surprise anyone. We don't see better. We don't run faster. There are things that, just sort of decline. But knowing that in advance and starting in your 50s. So I love your comparison of making deposits and investments. Just doing nothing isn't nothing. You're actually making withdrawals.
Right.
It's like people say, oh, I don't need to drink a lot of water. I'm not in the sauna. I'm not running. I'm not in a hot environment. Breathing makes you lose water. Right. Literally just breathing. So you are doing withdrawals every day on your muscle mass and your strength. And so you have to start making deposits.
Absolutely.
And I hate weightlifting. I danced for 13 years professionally as a ballerina. Right. That was my first career before. And, I was like, oh no, I don't want to get bulky. I have never, women do not get bulky. You have to work so hard to get bulky, but you need to be lifting stuff that's really heavy for you at least 3 times a week. Absolutely. Lifting, pushing, and pulling, all of it.
Yeah, all the basic human movement patterns. I think
go build a log home.
You build a log home, exactly. Doing that, chopping wood outside, earthing, grounding, getting out in nature. Those are all important. But another question about semaglutide, are your patients, do you see changes in their A1C levels from beginning to end?
Yes, and we monitor them. So not everybody has to have blood work to do semaglutide, but if you do, of course, we get more information. We can help you even more deeply and better. I actually tell my patients who come to us who might be on metformin or other things, nobody who's taking insulin is a good candidate. So you can't take semaglutide, or you shouldn't if you're a type 1 diabetic or taking insulin as a type 2 diabetic. But I tell my patients who are taking the oral diabetes or pre-diabetes medication to stop, because we have seen a normalization of blood glucose with just semaglutide. And I just had a patient who says, like, I'm so excited to not have to take my metformin anymore because it always upset my stomach.
Well, that, and, from everything I read, you correct me if I'm wrong, but it also blocks the methylation pathways.
That's what we're thinking it does. And it's part of, how it might help the inflammation. And I mean, it's so far reaching. There's so many potential positive side effects, I call them, or benefits, increased memory, increased neuroplasticity, a decrease in cardiovascular risk, a decrease in inflammation. There's so many potential, but it's not for everyone. It is not a one size fits all, and it is a prescription, and you do need to talk to a doctor to make sure that it's right for you. And before we started recording, we were talking about one of the potentially really scary side effects of pancreatitis. And we have yet, knock on wood, have a patient who has had pancreatitis. The mechanism of action, in my opinion, is partly due to, this medication is actually going to your pancreas. It's knocking on the door and saying, hi, we normally produce X amount of insulin to lower blood glucose. We're going to ask you to produce twice as much. So the pancreas is actually working harder. Now there's probably, 10 other mechanisms that are, for biomedical scientists to explain. And I'm a practitioner that sees patients and don't spend the time in the lab. So we'd have to ask them. But a history of pancreatitis, is one of the contraindications for taking semaglutide in our practice. But I also tell patients to avoid or severely decrease alcohol consumption for the same reason. Now, it's just my brain that says there's an increased risk of pancreatitis if you drink a lot, and there's an increased potential risk of semaglutide. And when you put them together, that would be a bad thing. So we're telling patients, just don't do it. This semaglutide isn't forever.
Right.
It's a tool to get you an outcome that's going to benefit your life. So you know what else though? I have had patients who are really on the fence about, like, they really did struggle with, okay, but I'm not sure. I use alcohol to de-stress. I use alcohol to relax at night, and I don't have a problem, but I drink 2 or 3 every single day and more on the weekend. And they were really reluctant to use semaglutide because they weren't sure they wanted to give up that tool for stress.
Right.
Another conversation about that. But what they have said is that they don't crave alcohol anymore.
Wow.
And I hope that there's a future FDA clinical study to use semaglutide instead of like antabuse, as a way to curb the craving for alcohol, because that's what we've seen in our practice.
And you mentioned something about, it benefiting brain health or possibly improving cognition. Is it true that insulin resistance happens in the brain first before it happens everywhere else?
I don't know if it happens before, but we definitely see insulin resistance in the brain. There's actually some studies where there was intranasal insulin done for patients who had dementia, and it actually improved. We know that glucose, the brain is the hungriest and greediest organ in the entire body for glucose. And so there is a glucose metabolism problem in all of the things that affect our brain, not just Alzheimer's and memory and dementia, but all of the neurodegenerative diseases actually have this glucose metabolism issue that we can see when we do PET scans and things like that.
That's why they call Alzheimer's type 3 diabetes, correct?
Yeah, they do.
And so with semaglutide, do people tend to gain weight back once they stop the medication?
You can, if you're going to go back to eating bonbons and sitting on the couch, then absolutely you're going to gain it all back. But hopefully what we have helped you is to create new habits and also taught you replacements. I think it's so ridiculous when doctors say, oh, don't do this and don't do that and decrease your stress. It's much easier to replace than remove. So
Right.
we dive deep into like, okay, if I have one patient and she's like, potato chips, that's like my weakness. And so we're like, okay, crunchy, salty, so we're finding replacements that actually meet what you're trying to get the experience of. The other thing, and this is not FDA approved, is that we're using semaglutide in microdosing after patients have reached their goal weight to help them with maintenance.
Awesome.
Yeah.
Awesome. And have you had anyone who lost a lot of weight, let's say 75 to 100 pounds, and then they didn't gain any of it back?
Yes.
Awesome. And those,
Yeah.
I'm guessing those are the patients who changed their lifestyle, their eating habits, their sleep.
Sleep is so big. People don't really appreciate how much sleep has to do with weight loss. And, our program, people get all these tips and education and information in their inbox, a couple times a month. And one of the first ones that they receive is about sleep, because it's so important for so many things, your brain health, but also for weight loss.
Absolutely. Yeah, I mean, I know that when you don't sleep, it alters serotonin and dopamine levels. So you're going to crave more food in general, but especially carbohydrates to bring your serotonin levels up. It's going to mess with cortisol, which is going to mess with insulin. And so I know they did a study, I think it was at the University of Texas, where they took medical students and they had them in the lab. And every time they went into deep sleep, they would shake them.
Wake them up.
Yeah.
How
After
cool.
I think 3 nights, every single person had, or almost every single person had the signs of prediabetes or diabetes, hypertension, dementia, or mild cognitive impairment. You know, the list was a mile long.
Yeah, well, when we sleep, it's like the big cleanup job. It's literally like the body elves go to work. And one of the things that the body does while you're sleeping is to clear amyloid. Everybody's like, oh no, amyloid plaque, Alzheimer's. We all have amyloid plaque, but we clean it when we sleep.
The lymphatic system, right?
Yeah, everything is in a cleanup mode. Your body sends out, cells to go look for precancerous and, getting apoptosis to take out malfunctioning cells. And your entire GI system actually relaxes and opens so that you can flush through. Have you ever noticed you need to void in the morning? That's because everything opened up and flushed through.
Right. Absolutely.
Big cleanup job.
And people who have been on semaglutide, have you seen changes in their microbiome or gut health as a result of weight loss?
I think the correlation between the microbiome and semaglutide is difficult because it has so much to do with what you're eating and your environment. Do you have a pet? Do you go outside? Do you use, hand sanitizer 400 times a day? There's so much that goes into that I haven't seen any studies yet on the evaluation of semaglutide with the microbiome.
So let's talk about, everyone knows the importance of testosterone in men. And I want to talk about testosterone in women because anecdotal story, about 8 years ago, I took my mom to see a local MD, and I had a copy of the results, and her testosterone was pretty much non-existent. And I asked the physician, I said, aren't you going to write for some testosterone because she already has osteopenia? Oh no, I only do that for women who want to have intercourse a lot. And I said, well, what about bone health, heart health? And so there's a lot of miseducation, misinformation around that. Can you speak to testosterone in women?
Literally, I wrote the book about it. The hormone secret. The secret hormone is testosterone for women. And hormones are a symphony. And so you can't just say, optimize testosterone and your life is going to be fabulous. But what happens is the contrary, where women who are going through perimenopause or menopause, their doctors will order tests to evaluate hormones, but it's actually pretty rare to order testosterone. So I'm surprised that your mom even got a testosterone test. And then with regard to testosterone, there's total testosterone, and then there's free testosterone. And then there's something in the middle called sex-hormone binding globulin, which is the carrier protein that carries around testosterone and other hormones. But we're talking about testosterone, so we'll stick with that. And I compare it to, so if you have a building that you're building on an island, you need a whole bunch of workers on the island to build it, right? Mm-hmm. And so the workers are your free testosterone. And the boat that's taking them there is the sex hormone binding globulin. And the total testosterone is counting up everything that's in the ocean. Who cares? I want to know how many people are building my building, right? Because I need the work to get done. Absolutely. So free testosterone, knowing what your free testosterone is, either a direct measurement or a calculation of total with, you're taking into consideration your sex hormone binding globulin, is essential. And that's the starting point.
Right.
And we have testosterone receptors in our brains. We have testosterone receptors. We used to use testosterone for men and women to treat depression, osteoporosis, just low energy, adrenal fatigue. For women, I don't find that libido is one of the first things that is either A, helped, or B, noticed when their testosterone goes down. I just want to like help women out there realize that once you get into your late 40s, your 50s and 60s, if you have a high libido, that's great for you. But if you don't, stop shooting on yourself. Mother Nature designed a libido to help you want to procreate, and you are not going to procreate. So your libido is going to completely change.
Right.
It is not going to be at the forefront of your mind anymore. Now, that's not to say that sex shouldn't be pleasurable, enjoyable, and you want it with your partner, but it's not the same as for men. Men can procreate until their 80s, and so sex is on their brain. So stop beating yourself up because you're not thinking of having sex. It's different, but it should be very enjoyable. The thing that I notice the most about testosterone deficiency in women is their ability to lose weight and their muscle fat ratio and their energy and their brain fog. Those are the top three things that I notice when we optimize women's testosterone.
And do you use a urine test, saliva, or how do you measure or monitor a woman's hormones?
So ideally, we have a relationship with patients for a long period of time. It's more that Eastern philosophy of my job is to continue to look under all the rocks and keep you optimizing your health in every way that you didn't even know was possible, instead of seeing you once a year and seeing if you're sick or seeing you if you're sick. So over time, we do use all of those testing modalities. And I think that, blood is super easy. Everybody can go to a LabCorp request and you can do a home finger prick test. There's some really great tests that are serum based. Saliva is actually very useful as well. But urine is special. And I think that everybody needs to have their hormones tested, at least after they've reached a steady state, because the metabolites of what all of your estrogens and your testosterone and all of that become matter. And if you're testing them at the saliva or blood, you don't know what they're going to become later on.
Right.
But by definition, the end metabolites can be seen at the end.
Right. And you can see the different types of estrogen and see where
The
you stand.
216 hydroxyestrone ratios and things like that, the methylation, that combined with a DNA test of are you deficient in your methylation abilities with MTHFR, either homozygous or heterozygous. And so these things are super important to know, because just giving somebody hormones so that their blood test reaches a certain level is very superficial. And what is underneath is just as important, if not more important.
And I've had a few guests talk about hormones, different hormones and different aspects of hormones. But what I always tell people is that in general, you want to balance cortisol, insulin, and your thyroid first before you move on to your sex hormones. It's kind of like Maslow's hierarchy of needs applied to functional medicine.
We do a little bit. I mean, that's ideal. I always say that the thyroid and the adrenal glands are married. So if you don't treat them together, you're never going to be successful. However, it's also, we treat more in a customized way. If you have a woman who is having like 7 to 9 night sweats where they're ripping off their sheets and they're drenched in sweat and they're having to change their pajamas multiple times in one night and not sleeping, that's where we start.
Yeah. Yep. That's a good point. That's a good point.
Yeah.
Yeah. So what would you say is the number one predictor of successful patient outcomes, just in general, no matter what condition or imbalance you're treating? Is it someone who's already been on their health journey for a while, or what would you say is the biggest variable?
I think communication, actually. Whether you're a doctor who has a patient who doesn't tell you what's going on, and just says, oh, I was still having hot flashes. So I just went to my regular doctor and started taking the oral contraceptive pill. To me, that's a patient that, I wish them well, and I release them from my practice. Because I'm here for you. Our doctors are here for you. We have a HIPAA compliant encrypted portal where you can send us 10 messages a day and we're going to answer you. We really are a team. And then on the patient side, if you have a doctor who doesn't listen to you and doesn't let you ask questions, and if you say to a physician, I hear what you're saying, that bioidentical estrogen topically with a cream is the best way for me, but there's no way I'm going to remember all of that. Is there any other option? If they can't give you a plan B, plan C, plan D, plan W, you're also have the wrong practitioner. So I think communication and relationship is one of the most important things.
Awesome. So what would you say is something, you and I were talking about meditation a little bit. Would you say that's something, the biggest variable that you wish you knew about before, but you use now in your practice?
I have an incredible sort of meditations personal story. So I have always had the philosophy that we have 3 pillars for optimal health. One is structure. And that's what drew me to stem cells, is that, we can actually affect the structure of something and regenerate it. We can literally see in a petri dish,
Right.
that we can regenerate or generate something with stem cells. The second is chemical. And so that what led me to be a hormone specialist, and neurotransmitters, and even our nutrition gets broken down into chemicals. And the third is never talked about in traditional medicine. And that's the frequency, the vibration. Every single cell in your body has an electrical current. It has a frequency. And it turns out that that frequency can be altered by your mind. And one of the ways to do that is with meditation. So if you have all 3 pillars optimized, there is nothing that's going to shake your health and your vitality. If you have 2, then you probably feel pretty well, but it only takes a relationship breakup, a job, or a worldwide pandemic to make you feel unwell, or maybe even get sick. And if you only have 1, you probably already have a diagnosis of a disease. And so I wanted to investigate meditation, because I would talk about meditation over and over and over with my patients. And I was like, they're just not doing it. And I don't know how to help them. I, give them links to,
Right.
Headspace and all this stuff. So if I'm going to spend my own time, energy, and money on something, I want to make sure that it's evidence-based and scientific. And so the person that I chose, there's lots of people out there, but Dr. Joe Dispenza is somebody that's doing the research on what is happening with meditation. There's blood work and all kinds of stuff. He's doing it with the university. So I went to a week-long retreat, and I sat down there and I was like, okay, I'll, just learn a few breathing techniques, and I'll be able to share them with my patients. And I had an absolutely transformational experience.
Wow.
And meditation is part of my daily life. It is as important as brushing my teeth. In fact, I feel like meditation is brushing and cleaning your cells of the inflammation that you've accumulated each day. That obviously happens no matter what you do or don't do. You're going to get inflammation from the pesticides, from the, And I want my patients to feel as gross going to bed without having a day of meditation as they would if they didn't brush their teeth all day.
Wow. And do you have any particular apps, or I have somewhere a Muse device, the headband,
Yep.
that can help people who are just starting out?
I was looking around for my brain tap. So I think everybody should have several things in their tickle trunk. There's some days where I just can't sit in quiet and meditate. My brain is just too busy and it's got all the like things to think about and worry about. And I know the goal of meditation is not to have no thoughts, but I'm not able to release them like bubbles and let them go very easily on some days. So those days I have, a list of guided meditations. I like Dr. Wayne Dyer. I like Dr. Joe Dispenza. I like Dr. Andrew Weil. So I have a list of them. I love Brain Tap. Brain Tap has got guided meditation music. There's some that are 10 minutes. There's some that are 30 minutes. So Brain Tap is amazing, plus so much research, right?
Yeah.
I like HoloSync, the no brain beats. And so I think the most important thing is actually to schedule it. If you expect meditation to happen, if you have time, it won't. Your day will be consumed. And then meditating at the end of the day, laying in bed, is the worst thing to do. Of course, you're going to fall asleep.
Right.
So scheduling it as a very important activity for yourself and treating it as an appointment that you wouldn't break. You wouldn't not go see your OBGYN. You wouldn't not take your dog to the vet.
Right.
Make yourself that much of a priority.
Absolutely. So you've given us a lot of sage wisdom. Is there anything else that you want to cover or you want to leave listeners with in terms of action steps for their health?
I think I'd just like to inspire people to, find a practitioner. Don't wait until you're sick. Find somebody that will help optimize your health and keep optimizing your health span and your lifespan. Looking at microbiome, looking at metabolic health, looking at hormones, looking at DNA, looking at your weight, just and in a very customized way. And whether that's with us at BioThrive, telehealth, or anybody, it's up to you to pick a partner in health. And I think that, people look at coaches and they look at counselors and they look at business coaches and they look at trainers. I think that doctors should be kind of in the same group of a partnership through time.
Co-learners.
Yeah. Yeah. A
Exactly.
guide, somebody who's going to help you on a path that they've been on that path with other people before, but it's your first time.
Absolutely. Well, very well said. Thank you so much for your time. Hopefully we can have you back on in the future.
It would be my honor.
And once again, thanks for the work that you're doing.
Thank you for all the work you're doing. Have a beautiful day. Thank you.
You too. Thank you.